Can CVS detect birth defects earlier than other tests? Imagine finding out about potential health issues in your baby sooner rather than later. That's what makes understanding when and how tests like chorionic villus sampling are used so important. Chorionic villus sampling, or CVS, is a test done during early pregnancy, usually between 10 and 13 weeks. This is earlier than amniocentesis, which is typically performed after 15 weeks. Because CVS happens sooner, it can give families important information earlier in the pregnancy. The test involves taking a tiny sample of cells from the placenta, called chorionic villi. These cells share the same genetic makeup as the baby, so testing them can reveal certain genetic and chromosomal conditions. CVS is very accurate for detecting issues like Down syndrome, which is caused by an extra chromosome 21, or other chromosomal abnormalities such as trisomy 18 and trisomy 13. It can also identify some inherited disorders like cystic fibrosis, Tay-Sachs disease, and sickle cell anemia. The accuracy rate for CVS is around 98 to 99%, making it a reliable choice for diagnosing these conditions. However, CVS cannot detect all birth defects. For example, it cannot identify neural tube defects like spina bifida, which are open defects of the spine and can be seen later in pregnancy with other tests like ultrasound or amniocentesis. Amniocentesis, performed after 15 weeks, involves sampling the amniotic fluid around the baby, which can reveal different types of issues, including neural tube defects. Non-invasive prenatal testing, or NIPT, is another option. It's a blood test that analyzes tiny fragments of fetal DNA in the mother's blood. NIPT can be done as early as 10 weeks and screens for the risk of certain chromosomal conditions. But it's only a screening test, not a diagnostic one. If NIPT shows a high risk, then CVS or amniocentesis is needed for confirmation. So, in terms of timing, CVS can detect some genetic conditions earlier than amniocentesis because it is performed sooner. But it does not necessarily detect birth defects earlier than NIPT, which is a screening test done at the same early stage. CVS provides a definitive diagnosis for specific genetic and chromosomal issues, which can be very helpful for families wanting early answers. It's also important to remember that CVS carries a small risk of complications, including a slightly higher chance of miscarriage compared to amniocentesis. The choice of test depends on your specific situation, family history, and what conditions you want to screen for. Always talk with your healthcare provider or genetic counselor to understand the best options for your pregnancy. In summary, CVS can detect certain genetic and chromosomal birth defects earlier than amniocentesis, but not necessarily earlier than screening tests like NIPT. It offers a quick and accurate diagnosis for many conditions, helping families plan and prepare sooner.